In order to work on the lower anterior teeth, that is 4-3 to T3, using a push scaler or any of the sickle scalers, you should be seated in the 7 o'clock position. The 7 o'clock position means that you're seated with your back upright, your feet flat on the floor and your legs parallel almost to the floor. You should be facing the patient. You should always be comfortable when you're scaling. This position is the best position for scaling. In order to begin scaling the lower anteriors with the push scaler, you would have your fulcrum finger for your mirror in place. Place your mirror lingually. A fulcrum finger for your instrument in place. And the instrument rested on your fulcrum finger. You're then going to use this instrument in a push stroke from the labial to the lingual, mesially and distally. When using the push scaler, care should be taken to ensure that the edge of the instrument does not catch the gingiva. This instrument is used supragingivally only for the lower anterior teeth, and it's used from the labial aspect through to the lingual aspect. The instrument should be placed mesially or distally, and the edge of the instrument slipped very slightly underneath the gingival margin. Push movement is used in an attempt to chip the calculus off on the lingual aspect. This can be seen in the mirror. Care should be taken when using the instrument to check in the mirror to ensure that no damage is being done on the lingual aspect to the gingival papilla. Some degree of bleeding is always experienced during scaling, as the tissues are inflamed. A systematic process of scaling should be adopted in order that you don't miss any area. In other words, you could start from the distal aspect of the lower right 3 and work on the distals of the lower right all the way around to the mesials of the lower left and then come back. Or you can do the distal of one tooth and then the mesial of that tooth and then change the instrument to do the next tooth. The sickle scaler, numbers H6, H7, is a double-ended instrument in your kit. The instrument has a blade on one side. One side of the instrument will be used on the mesial aspect from labial, and the other end of the instrument will be used on the distal aspect from the labial. So you will use both ends of this instrument from the labial aspect and both ends of this instrument from the labial aspect. The instrument stroke should be started at the labial aspect in the midline and swept round to the distal, removing calculus supragingivally. The very point of the instrument can be placed slightly subgingivally, but only slightly. And great care should be taken to turn the instrument round into the distal aspect in order that the papilla is not caught by the point. When using this instrument, either from the labial or from the lingual, the whole instrument should be held straight in the long axis of the tooth. This ensures